So, have you seen these headlines about a pharmaceutical company tripling the price of a drug called Mytesi during this global pandemic? The headlines would make anyone angry, but let's slow down here. I asked Jaguar Health's founder and CEO Lisa Conte to join me for an exclusive video one-on-one about the price adjustment, and I wanted to give her the opportunity to explain the real story of what happened. For full transparency, many of you already know that I own a brand and social media marketing shop in Nashville. I have worked with a subsidiary of Jaguar Health for nearly 3 years. My consulting consists of social media marketing. I'm also a patient that takes this drug, but you also know my ethics and my ability to ask tough questions regardless of all that. But just wanted to be fair and transparent about the relationship. I'm Josh Robbins, and this is HIV Scoop, exclusive one-on-one with Lisa Conte, founder and CEO of Jaguar Health, the company behind the drug Mytesi. News of a price adjustment for Mytesi came out, and as someone that is also a patient for this drug, it was concerning to see that a pharmaceutical company was tripling the price of this drug. And that's not the person that I know you to be or the company to be. And there's real concern, like, what's going on here? When did you decide that you wanted to adjust the price of the drug? Or when did those discussions happen?
Okay, the discussions to adjust the price of the drug that we're talking about is Mytesi, which is, of course, approved for diarrhea, chronic diarrhea, people living with HIV/AIDS on antiretroviral therapy. Okay, the decision for that was made in December of last year, December of 2019, based on about 18 months to 2 years of experience commercializing the product and learning that patients were having remarkable barriers to being able to access the product, to be able to get the prescription that came from the intimate conversation between their physician and the patient, the advocacy of the patient, the education of the physician of this first-in-class product, and then insurance companies were putting up barriers for the patients to be able to receive the product. So we put together a whole program where we term patients over payers. How do we provide services to the patients, to the healthcare professionals, to remove these barriers so that they can get their prescription? And that does include a price adjustment. So let's talk about, in the United States, what does pricing in the pharmaceutical industry mean? I mean, it's not like the pricing of getting a Hamilton ticket. It's not normal supply and demand. So in the private sector, in the public sector, ADAP, Medicaid, VA, 340B, the price does not change. In fact, the price actually goes down a little bit. So there will be no additional resources taken out of that system to provide Mytesi to patients. I can also tell you that there is no patient who will not have access to Mytesi because of a price adjustment, because of cost. And in fact, the converse is true. More patients will be able to have access to the product. How is it?
Yeah, how is that?
How is that? Okay, our crazy reimbursement system that does not work with a sensational headline is in the private sector. Insurance companies, what do? We've all experienced this, whether you're in the community or not, prior authorization. They get to decide that even though your physician has prescribed a particular product to you, they're not so sure that you should be getting that product. You should have to go try OTC things, opioids, antimotilities that have never been tested in people living with HIV/AIDS, that are not approved for chronic use, that interfere with other complicated medications that the patients take. They decide that you should have to try that and that you should have to file paperwork 1 or 2 times and appeal and sit on the phone. Craziness. So we made this decision in December to implement in April. What were we doing during those 3-4 months? Pulling together the services. So now there's a hub service that will assist patients, will assist physicians. There is somebody that we're paying that will sit on the phone with your insurance company and deal with your appeal. Like, can I have that, please? That's wonderful. There is patient assistance program for those who are 5 times or up to 5 times over the federal poverty limit if they don't qualify, if they're not eligible for ADAP, they don't have private insurance, somehow they fall into that whole product for free.
Yeah.
Well, we're working on appeals and prior authorizations. We'll provide bridge drug. This is a chronic medicine. Get on the product and stay on the product, particularly if you've lost insurance, you changed jobs. Right now, with what's going on, a lot of people may be losing their insurance, bridge drug. So these are all services that we're able to provide, including a price adjustment that is only affecting the private sector, those insurance companies that were putting up the barriers for the patients. So we're choosing patients over payers.
Yeah, so a patient like myself, I'm somebody that takes this drug. What is your commitment as far as copays? Let's talk about that just briefly. Like I won't pay over a certain amount of money as a copay.
So copay, an issue with private insurance, we now have a program where nobody will pay more than $25 for a prescription. And that includes if the prescription these days, again, because of the corona, it's a little bit easier to get 3 months filled versus 1 month of any medicine. That 25 will apply for the 3 months. So it's essentially $8 and a little bit per month is the maximum copay. Because, we've invested for 30 something years in developing a medicine, and we're developing it for other patient populations as well, Mytesi for other patient populations. But we're learning we have to invest on the commercial side. We have to invest on the access side. When you're a big company, this is our only product. This is our first time commercializing. When you're a big company, you walk into the insurance companies and you bundle, your billion-dollar blood pressure lowering medicine and your cancer medicines all together, and everything gets covered and everything gets a high priority. We have no chits to offer, so we're at the bottom of the stack in terms of getting any prioritization from the insurance companies to make it easier for patients to have access. So we got it. We're learning. We're investing now in patients.
So, and like we're so thankful for that. Tess Anderson asked me to say, like, what prompted you to expand the Napos Cares program? What prompted that? And then also he wanted to know, like, just simply why did you look at the pricing in business and then decide to adjust that price? Like, what made you make those two decisions?
So Napo Cares is the umbrella for everything that we talked about. So the copay, the patient access program, the prior authorization assistance with all that, the hub. Okay, why did we decide to do that? I was so struck by learning that over a third of these prescriptions that get written do not get filled because of these barriers. And that then this is a chronic medication. So the second time round, often after 3 months of a prescription, the patient has to go back and the physician has to do this whole prior authorization thing again for a chronic medication. I mean, people in this community who have this condition typically have inflamed guts for the rest of their life. And this is something that normalizes that gut function, normalizes, let's talk about poop, normalizes stool formation. So I was driven to how do we innovate on the commercial side as we innovated on the drug development side. And that requires investment. Okay, how are we going to do that investment? And we're not going to hurt a patient. Every patient has to be able to have enhanced access because of this. And so then, you get educated and learn about the US healthcare reimbursement system. Don't touch the public. On the private, it's the payers, that the private payers that are putting up the barriers, and they're the ones that are going to see the price adjustment. But in a screwy way in the United States, they, how do you get more attention from the payers? You offer them discounts. But you can't offer them discounts from a price that's already just barely over your cost of goods. So the system sort of requires you to have an artificial price adjustment so that you can offer a discount so that they can remove barriers so that we can prioritize patients. So everything comes back to the patients, but that is a hard story to get in a sensationalized headline.
Yeah, well, and it's kind of a boring story, I think, for like, to
Did
be
I bore
honest.
you?
No, 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 not at all. I'm just saying that like it's a business decision that just makes sense. I mean, I'm a business owner, and when you have the cost of something is more than what you can sell it for, you can only sustain that for so long without going out of business. What would have happened to your company if Mytesi, if that price adjustment wouldn't have happened?
The commercial business did not have much longer to go losing money. You can just, withstand, investors can just withstand that so long. So for, much of our 30 years of existence, we were a risk-based R&D development company. You can
Mm.
lose money for a long time before your product gets approved.
Right.
Hundreds of millions of dollars. It took over $300 million to bring Mytesi to approval. But once you have a product approved and you're selling it, investors expect you to get to break even and start to make some money.
Right.
So the commercial business was at risk of going away. And then the only way this product would not be provided, that patients would not have access to this product, is if that commercial business went away. But we now have in place a very exciting, financially sustainable business model that prioritizes patients. And that's why I'm smiling despite these horrible headlines, because I know we're doing the right thing.
Is it possible that the price has been too cheap for too long?
Mm. Well, I was in, first of all, let me say what a gift to me it's been to learn about the community over the past 20 plus years. And the old mantra in the pharmaceutical industry, if you can help one person and not hurt anybody, why not? Why would you not do that? And that's why we're all committed, and that's why we're here. And
Napo and Jaguar, you guys also did the HIV Community Conversations Monthly, sponsoring that, and you did the Activist Summit. Nobody else is doing these sort of things before, everyone had to be virtual. The question was like, do you think that the price of the drug was too cheap, too long?
So in retrospect, yes, of course, we didn't put it out at the right price level. But we didn't, we never commercialized a product before. And as I said, it was 18 months of learning, being hit over the head, bashed over the head with why were these prescriptions not getting filled, and having to understand this whole reimbursement system to figure out how it's like going through an obstacle course, going through landmines. How do we take care of the patients? How do we not touch the public funding? How do we not take any more money out of ADAP or Medicaid, for God's sakes? And how do we make sure that we can invest in the patients? So in retrospect, we didn't know. But the other thing is I didn't choose the price. So we won't go into that ugly history, but this product was initially commercialized by a big company that decided to deprioritize it, didn't care about the HIV indication, wanted to basically make the product go away. We fought, got the product back, so we inherited a price and then needed to learn everything about it. So now we have it, it's informed. It's the right level to keep the business financially sustainable, and that's the only thing that would ever interfere with product getting to patients. I was just going to say, during this time of pandemic, how the community, like you guys have shown how to thrive through a pandemic. This is not your first pandemic. And you've also shown the pharmaceutical industry, this community, how to accelerate safe drug development. So there's so much the pharmaceutical industry needs to thank you for. There's so much the world now experiencing a pandemic needs to thank you, the community, for. And that's why we're investing back. And that's why I'm smiling. This is a good thing.
But I just appreciate you taking the time, honestly, and just telling your story and the story of this medicine. I just want to say thank you. And any last words, any last thing you want to say before we end it?
I want to stop talking about this price adjustment and start talking about this condition. There is no new normal, except maybe after this pandemic, the world is going to be new normal. But when it comes to bowel function, there's only normal. And we need to let everybody know that you don't need to live with a new normal. Go talk to your doctor, ask them about Mytesi, and let's learn about this really safe, non-opioid, natural plant-based medicine to, help with some of these long-term neglected comorbidities that the community is dealing with.
Anyway, thank you, Lisa. And everyone, thanks for watching. Bye.
Bye.